Little did I imagine when I came back to the Board of Supervisors some years ago that I would have occasion to show up with a piggy bank in my hands, but here we are, and if this is what is necessary to make sure that even more folks here in Santa Clara County are the beneficiaries of our MedAssist program, then I am happy to be here. More than 20,000 folks have been prescribed these high-cost EpiPens. More than 100,000 folks here in Santa Clara County have diabetes. More than 250,000 folks here in Santa Clara County have asthma and probably need an inhaler. All of these products, life essential, highly expensive, and frankly, forcing people to make choices in their daily lives that no one should have to make. We now have a program that serves folks that are in the so-called missing middle, people who make what we used to think of as a pretty good middle-class income, but who are struggling with the high cost of living in our county and with the extraordinarily high cost of these particular drugs.
We found out that those MedAssist enrollees, those 1,400 we talked about, actually had a 50% lower rates of visits to the emergency room. Ultimately, medical adherence means reduction to other much more serious complications, leading to, of course, much better patient outcomes and healthier community. Go to the website and look to see if you can file and apply for this very easy to apply for but important program, because you will get this assist 4 times a year quarterly check to help pay for this prescription. No matter where you get your care, whether through the Valley Medical System or other healthcare system, you can still get support with these expenses if you qualify for MedAssist.
Regarding our new logo, as you will see, the new logo has 2 hearts coming together. One heart is the heart of the MedAssist program, which genuinely cares about the health and well-being of residents of Santa Clara County. The second heart is the heart of the recipients who rely on the support of MedAssist to stay healthy. Since the inception of the program, we have been using the image of the piggy bank to represent the financial assistance that the applicants receive when they apply to MedAssist. This is a friendly, distinctive, and a cheerful sign that clearly indicates that the program will reduce financial burden to the enrollees and help them get better care. So if you are taking life-saving medications, call us. Apply at getmedassist.com. The application is simple and the staff is here to help. Once you are approved, you will start getting your financial grant within 30 days. You can continue to pick up your prescription from the pharmacy of your choice. That continues as usual.
I'm a pediatrician, but I'm also a mother, and I have a child who has severe food allergies. So I know the peace of mind that comes from having an EpiPen with us at all times in case we need to use it to save my daughter's life. But in my practice, I see patients who can't always afford to have their medicines they need, or who skip doses or reduce their doses to make their medications last longer. That's why it's so wonderful that MedAssist grants make it easy and affordable to take life-saving diabetes medications regularly, to use asthma inhalers, and have EpiPens available. That means parents and their families can have the peace of mind that comes from knowing that they have the medicines they need when they need them.
I am a diabetic and I have asthma, so I'm fortunate enough to get a payment for 2 medications. And I would encourage anybody to apply for this program. I'm not at the top of that 100,000 by any means, but that's the other thing I like about it, because I always, even when I worked, was in that middle, and it was just kind of pushed out. So the fact that they had something that was available for people more fortunate than me, that's what I think is great about it. So if anybody can get it, I would recommend it to them.